The pancreas is an organ that belongs to both the digestive and endocrine systems of vertebrates. In humans, it can be found in the abdomen, situated behind the stomach, and is about the size of a person's hand. During the process of digestion, the pancreas creates pancreatic enzymes that work to break down sugars, fats, and starches. Pancreatitis is the inflammation of the pancreas. This happens when digestive juices or enzymes attack the pancreas. There are two types of pancreatitis: acute and chronic pancreatitis. Acute pancreatitis is characterized by sudden pain in the upper belly that may radiate to the back, tenderness when touching the belly, fever, rapid pulse, upset stomach, and vomiting. Acute pancreatitis can be caused by two main factors: excessive alcohol consumption and gallstones. In addition, malnutrition, trauma, or previous surgery, certain infections like mumps, Coxsackie virus, and hepatitis, complications due to medication, hypercalcemia, and hypertriglyceridemia can also lead to this condition. Other causes include autoimmune pancreatitis, idiopathic congenital duct abnormalities, systemic lupus erythematosus, hemolytic uremic syndrome, peptic ulcer, and Reye syndrome. The gold standard for diagnosing acute pancreatitis using imaging is a contrast-enhanced CT scan, but ultrasound, MES-EP, and endoscopic ultrasound can also be used. In addition to complete blood count (PCT), fecal tests, pancreatic function test, the most common CT scan findings in cases of acute pancreatitis include focal or diffuse parenchymal enlargement, changes in density, indistinct pancreatic margins, infected necrosis, abscess formation, hemorrhage, and calcification. As for the blood test, we can see a remarkable elevation in amylase and lipase at least 3 times above the reference range. Specifically, the lipase level is of greater concern as it is more sensitive to changes in case of acute pancreatitis. It is important to note that amylase and lipase are digestive enzymes that are secreted by the pancreas. Low levels of fecal elastase 1, (A3N) stool tests may indicate exocrine pancreatic insufficiency (AP). AP is a medical condition that occurs when the pancreas fails to release enough digestive enzymes. Typically, when fecal elastase levels are above 500 UG, pancreatic function is considered normal. On the other hand, when the levels are below 100 mg of stool, it is more consistent with EPIs. Patients with gallstone pancreatitis have significantly higher KK levels in gastrointestinal peptide, which can be detected through pancreatic function test. To confirm the diagnosis of acute pancreatitis, 2 out of 3 criteria are typically used. 1. Belt-like abdominal pain. 2. An elevated serum lipase level 3 times above the normal threshold. And 3. Radiological imaging signs of pancreatitis. For the treatment of acute pancreatitis, the initial priorities are intravenous fluid resuscitation, analgesia, and enteral nutrition. Indications for surgery in acute pancreatitis are for the treatment of acute compartment syndrome, non-occlusive intestinal ischemia and necrosis, enterocutaneous fistulae, vascular complications, and pseudocyst. Surgery also has a role in the prevention of recurrent acute pancreatitis by cholecystectomy. For prevention of acute pancreatitis, it is highly recommended to reduce alcohol consumption, adopt a diet high in lean protein and low in fat, and drink more fluids.